passionate about helping my future patients work on reversing or stopping completely in its tracks. So in this presentation, I will use stories because I think they're more impactful and they can bring the message across with more power. So I want to start with my 23-year-old male, who I'll call Todd, with obesity, who came to see me for the first time because just 2 weeks prior, he had almost died of a severe complication of type 2 diabetes called diabetic ketoacidosis. In fact, he had no idea that he had diabetes until that near fatal episode when his blood sugars were so high in the upwards of 500s that his blood became dangerously acidic. And as you may have guessed, he started on insulin during the hospital stay. And now here he was in my clinic, first time, which is insulin for the rest of his life and diabetes wreaking havoc on his body. And he a prisoner of this new reality. As a physician, it's very, very disconcerting for me to know that 10% of Americans have diabetes and 1/3 or 33% have prediabetes, meaning their blood sugars are high, but not yet to the level of diabetes. So Todd is now 23 years old, and even though his blood sugars are okay on the insulin, what he doesn't know is that over the next few decades, he will be depositing plaque in the blood vessels running through his heart, his brain, his kidneys, his eyes, throughout his whole body. And while he's adjusting to his life of living with diabetes on insulin, he doesn't know that there is the danger looming beneath the surface, which will one day result in him maybe having a heart attack or a stroke, needing a stent, needing dialysis, or even getting, issues with leg amputations. So now look here at the startling map of the obesity rates by states in the US. So looking at the map of the US, we can see that many of our states have the upwards of 25 to 40% obesity rate. There are different maps that you can find. I got this one on the CDC, from the CDC, but overall they show a very dark picture of obesity in the US. And so Todd's story reflects the problems of millions of Americans, as he represents a large segment of our population. And to know that the diet industry is a billion-dollar industry should give us all a very huge pause. So now we will shift to the major causes of this disaster. So as we know, Todd had a major wake-up call with his diagnosis of diabetes. He goes shopping to find low-fat and heart-healthy foods. He picks up a box of cornflakes, and he thinks back to what he learned about the food pyramid, which, so cornflakes cereal has no fat. It's not sweet, and it seems like a pretty good option for food that he can eat. Well, what he doesn't realize is that finishing one box of cornflakes is equivalent to eating 100 sugar cubes. So no wonder he's going to remain sick, fat, and diabetic as he stays on the standard American processed food diet. Between 1977 and 2000, Americans have nearly doubled their daily intake of sugar. In fact, the diet food industry has thrived over that time and has been doing all of us a huge disservice, replacing dietary fat, that villainized fat, with highly refined sugar that is effectively poisoning our system. So about 20 years before Todd was born, there was a huge push to lower the amount of fat in the American diet. And over the next 20 years, the low-fat diet food industry boomed. They removed the fat from foods, and they pumped in the sugar to make it taste good. And they ended up making us all sick, sugar addicted, endlessly hungry, and fat. So now Todd's story with diabetes didn't start when he was diagnosed, and this is really important. It started many years prior. In fact, some people who present with diabetes have had prediabetes for the preceding 20 years, and many without even knowing this. Todd's story really started as a kid whose body built up a resistance to a hormone called insulin. Insulin is a very important hormone to know, so keep it in the back of your mind. So now let's follow the path of that sugar once it's eaten so that we can understand insulin. Sugar, which is also called a carbohydrate, is swallowed into the stomach, and then it's absorbed almost immediately into the bloodstream. And then it floats around in the bloodstream until the cells of the body, like the heart, the eyes, the skin, etc., they all open up and let in the sugars, presumably to use it as energy. Well, cells are locked and they need a special key to open them up, and that key is called insulin. Once the insulin turns the lock and the sugar rushes in, then that cell makes a quick decision. Do I use the sugar for energy, or do I have enough energy already, and do I just store it then as fat? So now Todd has been eating a lot of sugar since he was a child, including all the processed food that his parents thought were good since it was fat-free or low in fat. And that sugar has built up in his body as fat storage. And he has developed the next condition that we're going to name, and that's called insulin resistance. Now, to understand this, think of heroin. The first few times a heroin addicted person uses heroin, they feel a good high, but this high becomes harder and harder to achieve over time as the person is in effect becomes resistant to that heroin. Well, with insulin, the more you flood your body with sugar, the more insulin you make, and the more insulin you will eventually need for every unit of sugar that you eat. So you build a resistance to that insulin. Treating Todd's blood sugars with insulin is good for bringing down his blood sugar, but his insulin resistance will only be getting worse and worse. And in the next 10 years, he'll go from needing 15 units of insulin to needing 50 or 100 units of insulin because he is creating his own insulin resistance. Now, there's another thing to note in Todd's case. As he starts insulin, he gains an extra 20 pounds. And he comes to me and he swears, I've been eating better than ever. I've been using all my willpower to stay away from the foods, even though I'm hungrier than ever. I just don't understand why I've gained all this extra weight. Well, insulin is the main signal to our body to deposit fat. And so when our insulin levels are high, we are depositing more fat. Poor Todd, he cannot win. And as we mentioned, little does he know that with his best efforts, he's still at very high risk of the buildup of that plaque in his arteries that may eventually lead him to a heart attack, a stroke, a kidney failure, or any other health disaster. Now, for those of you who are listening and do not have diabetes or prediabetes, why should you be concerned? Well, insulin resistance is not usually measurable by standard tests unless your sugars are high and you have prediabetes or diabetes. You can have totally normal sugars and have insulin resistance. And the factors that are making you most predisposed to insulin resistance are how much body fat and specifically visceral fat. Visceral fat is fat around the organs that you have, and how much processed or refined sugar that you are eating. And why is Todd so incredibly hungry since starting insulin? Well, two reasons. Number one is that as he's trying to limit his sugar intake, he's in effect going through withdrawal from his sugar addiction. And number two, the variability or ups and downs in his sugar level throughout the day are also making him very hungry. And so eventually his willpower gives out and he cycles for the next few decades through yo-yo dieting, increasing his insulin requirements, and most of all, frustration and giving up. And he dreads every doctor's visit where his doctor scolds him for not bettering his health while giving him treatment that have no hope of making him truly better. So Todd feels he has no hope ever of escaping this diabetes trap. And what he doesn't realize is that when his aunt referred him to see me, I'm going to partner with him and reverse his disease. So Todd sees me, and within 3 months, he's totally off insulin. He has lost 30 pounds. And most importantly, we repeat his blood tests, and he's no longer a diabetic. This is beyond exciting, and it has changed his life for the better, long term. Well, how did we do this? So under my strict guidance, we tapered his insulin as he stopped eating all processed foods and limiting his carbohydrates. And then he employed one of the oldest forms of dietary practice, which is called fasting. And in effect, he resensitized himself to insulin. So if you think of overeating or eating above your energy needs as stuffing food into your body's cells, then you should think of fasting as allowing your body to pull out this fat and use it as energy. So next we meet Debbie, a 45-year-old woman who's been through every diet program you can imagine. She started with Jenny Craig when she was young, and with great embarrassment, her mom would take her to her visits there. And she's still flooded with those negative emotions when she smells the foods that resemble what she got on that program. Society has basically looked down on her for being obese for as long as she can recall, and the emotional scars carry on into her adulthood. She too, like Tom, dreads every appointment with her doctor, as the scale and the doctor's concern about her weight seem to sink her deeper into self-loathing and frustration. And what has gotten her to this point? What is it that the diets that she's paying so much for and dedicating so much time and hope to are getting wrong? Well, most of us have watched The Biggest Loser, or at least heard of it. The dedication that you see from Biggest Loser contestants is tremendous. And the fact that in one of the studies, 13 out of 14 contestants regained their weight within 6 years of the show's ending. Some even going past the point of their previous weight, is mind-blowing. And our first instinct in our society is we're going to blame the victim. It turns out that even 6 years after the end of the show, the contestants suffered a slowed metabolism. And not to mention the emotional scars, those dysfunctional thoughts, and the belief that no diet will ever work for me. So what happened? With calorie-restricted diets, which is what the Biggest Loser was essentially, with calorie-restricted diets, our body weight set point never readjusts. And we get hungrier, and our metabolism slowly gets us back to our original weight. And often our metabolism stays so low that we eventually gain more weight than the original weight that we started at. So I see Debbie after she's at her wit's end with dieting. The last thing she wants to do is to listen to another physician scold her about her inability to stay on a diet. And I enroll her in a 6-month program with me. I give her guidelines for lowering her carbohydrates and intermittent fasting. At first, she's hungry and she does rely on willpower. But as her hormones quickly optimize, she starts feeling energetic, vital, and happy. But I don't let her off that easy. We sit and we work together on her mind. Because as you've probably heard, many people who go through bariatric surgery overeat so much that over time they even stretch out their stomachs that were surgically made smaller. It's not because of their physical hunger, but rather it's because they did not appropriately work on their minds. And that ingredient is so key. So I find out that Debbie suffers from a few dysfunctional thought patterns, one of which is that she has an all or nothing approach, which means when she happens to overeat, then she stops her new healthy eating habit and then she continues on from there to binge eat, thinking, hey, I've already, messed up my diet. I'm going to just start again next week. And she also has a hard time letting her husband know not to bring foods that are, snack foods or binge type foods into the house. And she doesn't feel comfortable with that imposition on her family for her health. And lastly, she has a very stressful job and she tends to reward herself with candy and sweets for emotional comfort. So, only by addressing her mind can we ultimately retrain her brain for success. And this is what I do with my patients. I do a complete metabolic health assessment and perform a physical. And then I educate heavily on the science and manage medical problems with the right approach. And then I work on the mind to ensure lasting success. And so here's a summary of my points. So, number one, your body really does have the power, in many cases, within metabolic disease, to self correct if you use the right approach. Number two is that the cultural and social habits within our society are really steering us off course. So we really have to put blinders on to all the noise. There's just too much misinformation out there. And lastly, to regain metabolic health, first and foremost, educate yourself. Know your risks, and then once you know and you're educated, you can remove those barriers that are standing away in your way of healing. And that's it. So I can take any questions, or Alex.
All right, very good. That was great, Dr. Lichtash. Thank you. If you could stop sharing the screen, we will chat with the people. All right, so the first question, the best question, we'll get a copy of this book. Like I said, I read it a number of times. It's The Obesity Code by Dr. Jason Fung. And Dr. Fung was one of the people who I researched among maybe about a dozen before I did my fast. And I actually did, I don't know if I told you this.
I don't think so.
So I did a 42-day
Wow.
Water only, no tea, no coffee, no supplements, fast. Yeah, it was grand. I was looking to, resolve the psoriasis part of my psoriatic arthritis diagnosis. And it was quite the experience, I lost 50 pounds.
Wow.
When my mother saw me on day 35, she started crying because I didn't look well.
You don't look like you could lose 50 pounds.
Yeah, I don't have that much weight to lose, but yeah, I did it. And then it was funny because as soon as I got off, I started eating, and I started eating very little, a little watermelon.
Yeah.
And I started eating watermelon. I started gaining like a pound, 2 pounds, 3 pounds a day. And then I went past where I started originally by 10 pounds.
Interesting.
And I wasn't eating a lot either.
Yeah. Yeah.
So,
Yeah.
but intermittent fasting is so uniquely different and so much more powerful when you get rid of the carbs and all that.
Yeah.
All right, guys. So anyone has a question for our doctor about anything, I suppose? I have a lot of questions. I don't know. Well, let's begin with this. First of all, a great presentation, very, very interesting, enlightening, and empowering. Garrett, all right, great. Would lowering carbs over, let's say, 2 weeks be best than go into intermittent fasting to get the body's insulin load and resistance to tone down? Good question. Excellent.
Very, very good question. So there are a few ways to start intermittent fasting. And one of the ways that's recommended is to for it to be easier for you to feel less hungry is to lower your carbohydrates. So what's interesting about fasting and low carb diets is that they're very similar in terms of how the effect that they make on your blood sugars. So meaning if you look at graphs of blood sugars over time with the fasting and with a essentially like very restricted carbohydrate diet, you see the blood sugars are both very even in those groups of people. Whereas with the American diet, it's kind of all over the place. And so, as I mentioned, variability in blood sugar is one of the reasons why we feel very hungry. So if you lower your blood sugars by doing a low carb diet, you might have an easier transition into fasting, into intermittent fasting. So you won't feel as hungry.
Just to say that, I've been off of most carbs for a long time. I don't eat bread really. And I think a lot of people in America are afraid that if they don't cover their, hamburger in 2 pieces of white bread, that they're going to starve to death.
Right.
And I don't think that's right because, the gluten here in the United States, a lot of the breads that we eat, that gluten isn't healthy. It's genetically modified. It's sprayed with a lot of pesticides. And I think it contributes to the damage of the gut. Would you agree?
I agree with that. Yeah.
All right, Ashley has a question. Are patients able to go back to a regular schedule of not fasting after getting down to their goal weight from intermittent fasting? Good question.
So I just published a paper with Dr. Fung, and we looked at a really unique case, which was a thin diabetic who really had no weight to lose. And she essentially was getting worse and worse in her diabetes. She was almost going to be on insulin at this point. Nothing really was working for her. And so she started doing long fasts to reverse her insulin resistance. So by long, I mean 42-hour fasts. And she's a really important case because you can see that even without losing weight, she was able to reverse her insulin resistance using 42-hour fasts 3 times a week and then going down to two times a week. And then ultimately, when she reached her goal, insulin levels, she was able then to pull back and start just doing smaller fasts and small daily fasts. And so it's always important to work with your doctor if you're working on your A1C, your pre-diabetes or diabetes. And it's not a one size fits all for everybody. But what that paper we demonstrated in that case is that insulin resistance, you have the ability to eliminate it or reverse it. And then you can be a little bit more lax with your fasting.
Great. Carolyn wants to know, how about organic sourdough bread since it's fermented? And do you incorporate essential oils into your patients' regimens in any way?
So that's a good question. I don't know about the fermented bread. I don't know if there is a different. So one of the interesting things that we should know about is insulin index versus glycemic index. So probably everybody's heard of the glycemic index. So potatoes, for example, have a really high glycemic index, meaning that your sugar goes, the rate at which your sugar goes up after you eat it is higher than if you ate something like beans or something that had a little bit more fiber. So insulin index is different. Insulin index basically is how much insulin do you make for every food that you eat? How much insulin does every food that you eat demand of your pancreas to make in order for you to use it? And so the data on insulin index is a lot more scant than glycemic index. We really don't know what it is, between the different carbs, what, maybe fermented sourdough bread has a lower insulin index. I don't think that that's known, and I'm not sure what the right answer, so I don't want to give you the wrong answer. And then in terms of essential oils, I don't incorporate them into my regimens. I don't know of any data showing that they might help. But in terms of fats that I use for patients, so I recommend olive oil in their diets, avocado, nuts, things that will help them with their satiety without giving them, because fat actually and essentially does not spike insulin. And so if you bring in fat into your diet, then you can help kind of both curb your hunger, but also help ultimately with your insulin resistance.
Great answer. I would add that you know, any flour, any dough that you consume is really not great if you're trying to lose weight or if you have some kind of a chronic condition, especially one that comes from a damaged gut lining. So I know a few friends of mine actually buy flour from France because they grow and raise their wheat very differently than we do here. But I think once you get well or get to your health goal, whatever that happens to be, then you can start incorporating different things and very gently and carefully if you want to. But I don't know what your goal is, but I don't eat sourdough or any kind of other dough. Karen has a question. Previously, there have been focus on simple versus complex carbs. Is this still relevant in your opinion?
It is still relevant. So I think that the ketogenic diet is something that is a tool in our basket that we can use for patients that have really severe insulin resistance or severe obesity that really need that to help them reverse their disease. But I think that the majority of people, if you tell them to eat a ketogenic diet, a lot of times what's going to end up happening is that they're going to eat a lot of fat and then miss the carbohydrates, not know that they're eating carbohydrates because they're going to sneak into their diet. And then it's going to be a very dangerous combination of high fat and high inflammatory things like, carbs. And so if you're going to do the ketogenic diet and eliminate carbohydrates and reduce them to 20 grams of carbs a day, then you can it's something that you have to do carefully and do knowingly. So you have to get educated about that. Now, with that said, with my patients that don't want to go the ketogenic diet route, I do bring in complex carbohydrates and things that are mostly what I do is whole foods. So whole foods. And I find that it does not hinder their success in reversing their insulin resistance if it's done correctly. And we work together to control, because every person is different. So complex carbohydrates are different in the way that in how much insulin you end up spiking and how quickly your sugar goes up after you eat it.
Excellent. Thank you very much, Karen. Great question. We have an anonymous question. Is fasting safe for people with heart disease?
Good question. So when we talk about fasting, so fasting is something you should think of as a natural phenomenon. We are all hunter-gatherers, evolutionarily. We're meant to store fat. That's why we store fat in our bodies, is so that we can use it for later when we don't have food. So it is natural for us to eat and then fast and eat and fast. Now, if you have heart disease and are also on diabetic medications, then you should definitely consult with your doctor on how to fast and what times, when is it okay? Can you do it when you're on your medications or not? So I always start my patients very slow, and we kind of work up based on how much success we're getting in terms of their weight and their insulin resistance. But overall, if somebody has heart disease, it does not deter me from using intermittent fasting.
I think we should be more concerned about intermittent overeating.
Exactly. Yeah.
a little fasting. But also, I mean, if you have some kind of chronic condition, that's also a little scary to do any kind of change. I hear you.
Right. Because if you fast for too long, then you do actually get, a sympathetic surge. Your body is in flight or fight mode at some point, because you're not getting enough, you're not getting the food that you're expecting. And so all of it should be done under careful monitoring to make sure blood pressure is okay, electrolytes are fine, because those are the big things. With heart disease, you don't want to end up with an arrhythmia or an abnormal rhythm of the heart. So I really carefully look at the electrolytes and the magnesium and potassium levels, and make sure that none of the medications that they're on can potentially lower those and then lead to an arrhythmia. So I think it should all be done under somebody's supervision that knows how to implement it for you.
I just want to add something to this point. I was diagnosed with psoriatic arthritis 15 years ago. And first I started working with a doctor who he started practicing functional medicine when he himself was diagnosed with terminal lung cancer. So he helped me in 3 months permanently resolve the arthritis part of this condition. The psoriasis part, I couldn't find an answer to for 15 years. But one of the mistakes I made is I tried to become a doctor myself. So I read, when I tell you, hundreds of books. I've created conferences where I had some of the best physicians from around the world come, and I would sit in the front row. I would interview them like this, and I try to figure out how to get to the root cause of my chronic illness. And you know what happened? Nothing. 15 years, I didn't budget. But also because I couldn't find a doctor that I could work with that actually did this kind of work after Dr. Lynch just passed away. So I found a doctor recently, and when she kind of started working with me, it's like when an expert puts their hands on a car and they start fixing stuff, you could see it's an expert hand there.
Right.
Stuff started working. You tried it, it didn't work, but stuff started working. So the reason I'm telling you this is that, look, the system has been set up in such a way that it guides us towards the direction of sickness, illness, obesity, chronic conditions. For us to get out of it, we need a professional on our side, like a coach, a mentor, somebody who has a emotional commitment to our well-being, and to help us through all this, circumnavigate all this nonsense. And that's why I love introducing doctors like you, who have really took a big step in their life to do this kind of care. So I'm so grateful to you, Dr. Lichtash, for you to do this and to be with us here. Natalie has a question for us. I've heard many times that intermittent fasting is not recommended for women the same way it is for men. Is there truth to this?
So I've also read that, but what you have to think about is, with intermittent fasting, is that what we're trying to do is really to modify the hormones that are underneath the surface. So the hormones that we don't see, but the hormones that also are driving us towards the diabetes, pre-diabetes, or heart disease, vascular disease, which all of us, even if we're not diabetic or pre-diabetic, we're all predisposed to. And a lot of it is our habits. It's the way that we eat. It's our stress levels. It's our sleep. Intermittent fasting will work for anybody, because we're all human beings. We all have the same hormonal the same hormones when it comes to metabolic disease. And so I have not found any difference in my practice between men and women when it comes to using intermittent fasting to help with treatment of disease. I find that both sexes tolerate it the same and fine.
Yeah. And when we spoke before, Dr. Lichtash, so I think you're a big fan here. Finding great doctors like Dr. Lichtash is like hitting the lottery.
Oh, thank you.
That's so true. I mean, there's so few of your, entrepreneurial type of physician out there that actually looks to work with people directly, like they did in the olden days,
Yeah. No, I wish I could bring I know a lot of people that I wish I could bring with me. Yeah, definitely.
So I know doctors who went back to, they have the little black bag, and they just go see patients. You know, they have direct relationship. There's no third-party bureaucracy getting in the way. It's wonderful. I mean, it's wonderful, but this is like a revolution in care.
Totally.
So,
Totally.
so I'm so excited about being a part of this with you.
Thank you.
What I want to say, yeah. So in the early 70s, you showed the graph of how you know, things evolved from the 70s, sugar
Right,
consumption.
the guidelines of on, you know, lowering fat in the diet. Yeah.
Lowering fat, increase of sugar, more carbs in the diet, 6 to 11 servings they were recommending. So it feels like, you know, the system has been kind of set up to guide us towards this obesity epidemic. I mean, it started to grow geometrically from the 70s. Now it's like they're saying, you know, we're all going to be obese and diabetic in by, you know, in 20 years. So definitely something's wrong somewhere.
So I think to your point, when there's a vacuum, you know, you can either fill it with good things or bad things. And I think the greed of a lot of these companies where they found, hey, I can make this low fat, but let me pump in all the sugar. That's what got us to this point. So if you go and you see all these snack foods or the diet foods, when you start eating them, you're going to be hungrier and hungrier and hungrier. It's just, you know, it's just hormonal. It's underneath the surface of what's going on. And so the vacuum, unfortunately, they made the low fat guidelines in order to, because they were seeing a lot of people dying from heart disease in this country. And instead, what came was the sugar, you know, the pumping in of the sugar into our diets, unfortunately.
Well, like we were talking about it before. When I first came to America, I was 10 years old. And, you know, the first thing I discovered was Frosted Flakes.
Right.
And Twinkies and all that kind of good stuff.
Yeah.
So I grew up on that stuff. And I think ultimately it caused a bunch of damage to my digestive system. And that's why, like in my early 30s, I started developing an autoimmune condition. And I think that's true for a lot of people. You know, once we damage our digestive system, we become toxic. We're not able to absorb a lot of the nutrition from the food, so we become depleted. Even if we try to eat well, you know, organic, nutritionally dense, still, if you're not able to absorb it, what good is it? Right. So, the problem is complex. That's what I'm saying. And we really need help to get through it. We need like a partner. That's why, by the way, the doctor I work with now, I joined her practice as a lifelong member. Wow. So instead of waiting until I develop a chronic illness of deficiency, toxicity, and damaged gut, we keep an eye on those things. I already like know what I'm dealing with here. So we keep an eye on that stuff, and we fine tune me like a fine race car, you know, because, you know, I work hard. There's a lot of pressure, a lot of stress. I can't afford to have a flat tire, so to speak.
What we're talking about is preventative care. And I think that's what that's what everybody should seek, is preventative care. And I am doing it as, you know, a part of what I'm doing is essentially, or a big part of my clinic is metabolic health, but really it's preventative care. And so that's how I see it too.
Well, listen, I think preventative care is great. So this way you don't get cancer, you don't get heart disease. But there's also this human optimization care that I seek, which is like, how do I get my body, my mind, and my emotions and my energy level to function at the very peak level of health expression? Mm-hmm. No? So it's not just about avoiding diseases. I think avoiding diseases happens naturally when your body has everything it needs and you get rid of everything it doesn't need, you know?
Yeah.
Carolyn has a question. I saw that. The longest I've done is 18 hours with fasting. I can't fathom going longer than that. But I knew my stomach was growling. How do I get there? After 3 days, I think my personal experience was all that stomach growling, but then I think your body switches from burning fat and sugar to from burning sugar and burning sugar, I guess, to burning fat. So and when that happens, my hunger went away. My mind was still hungry, but my body wasn't hungry. And I had this release of energy. I needed like 5 hours sleep, and I just had this energy happening. It was amazing. But yeah, no, I hear you. Now that I'm not fasting, I also get hungry.
I get hungry. So there's actually a study on, I think it was 72 or 84 hours of fasting, and they basically measured a bunch of people's ghrelin hormone. Ghrelin is the hunger hormone over that time, and they found that the highest ghrelin was actually day number one, and then slowly the ghrelin went down. And so what's really interesting is that even though they weren't eating, their hunger was going down. And so there are a lot of strategies to help with longer fast than 18 hours. And one of it is, the bottom line to know is that once you kind of get over the hump of that willpower in the beginning, things become a lot easier. But there are definitely strategies in the diet and and other things that you can do while you're fasting that will help you kind of get through those waves of hunger when you're doing that.
And just to tell you that there are a number of centers around the country, around the world, that focus on fasting. So you just go there and you fast for 7 days. Some of them. I know there's one center in Costa Rica. You go there fast. I think it's 26 days is minimum. But he fasts people for like 50 days. And I think the world record was like 380 days.
Yeah. Mm-hmm.
Isn't that crazy? 380 days.
Yeah. So the main thing to know with these long fasts is that you can get deficiencies of electrolytes, and and there's something called refeeding syndrome, which can be deadly. And so you really, really, if you're going to do those things, have to be under a supervision of a doctor, and especially in the times when you're refeeding. And so just be aware when you're doing these things to make sure that when you're if you're going to be in a center, that you're going to be in a center with physician oversight, because I know that some of the centers don't have physician oversight, and I think it's never do harm. Always try. As physicians, the first part of our oath is to not do harm, and so we want to make sure that we are doing this in a very safe and controlled way.
Yeah, absolutely. Dr. Lichtash, I wanted to ask you, so when you do intermittent fasting, how do you recommend people do it? For how long?
Some people are super insulin resistant, and for example, I'll start them off and they've never gone like more than 3-4 hours without snacking on something, and so it can feel really scary to them to do that. And so I'll start with 14 hours of fasting on those people, and then work with them on the carbs and really try to modify their diet so it doesn't feel overwhelming, because the last thing you want is to start somebody too quickly. I had a patient actually that was coming to see me, and I kept begging her, listen, don't. She kept having these lofty goals. I'm going to do 18 hours and then 24 and then this and that and 36. And I was, and she had really poorly controlled diabetes. And I told her, listen, you've been through all these things before. She went to fasting retreat and all this stuff. You see that if you push too hard, you panic, you feel anxious, and you don't feel good. And so we have to really do it. We have to really work with your body and how you feel when we're implementing intermittent fasting. Some people, super easy. They'll just start with the 36-hour fasts and they feel like they're totally fine. Maybe it's hard in the beginning and then they can get through it. But I think it really depends on the person, and it also depends on how insulin resistant they are. Sometimes when you're super insulin resistant, it's harder to fast because you just feel so hungry all the time.
Yeah. And what about foods? What are your like pet peeves? Where do you start? I get the sugar. What else?
Yeah. So usually what I start with is, how can we make a base of like healthy volume food? So like, what is it that you can, because I think that if you're going to if you restrict way too much, you just kind of rebel and go the other way. And so starting off slow is very, very important. So, what are the things that we can fill up on that are healthy, that give us micronutrients, that are going to, make us feel full and satisfied? And what can we throw in as comfort foods that are actually not heavy carbs that you can put into your diet so you feel good and you feel like you're satisfied, and then get rid of the rice and the pasta and all those empty carbs that you're eating that give you no nutritional value at whatsoever, and just make ultimately make you hungrier. So like all of those kinds of processed or boxed foods are the things that I first, right off the bat, we we agree to put them on the side. Some people really don't want to, and they won't. I had one guy who is has very poorly controlled diabetes and heart disease. He's obese. And I suggested to him, listen, you're not going to have any other doctor work with you like this. Let me do this with you. And he's like, no way, I'm not giving up my fast food, or I'm not giving up my, like, this is my pleasure. I want to eat this stuff. So like, you have to be realistic with every person. So
I,
whatever it is that the person, where you have to meet, you have to, if you're a good physician, you're not dictating, you're actually working with a person to make sure that what you're doing is going to be a long lasting thing.
yeah. Well, listen, health and well-being isn't for everybody. You have to earn it. You have to fight for it. You have to want it. And I get this attitude. A lot of people are like, you're not going to separate me from my Budweiser. Like, really? You find with the cancer and the diabetes and the heart disease and obesity and all that, you're good with that because you want to drink Budweiser? I just, listen, we live in America, right? Free country. We can do whatever we want.
Yeah.
But all of that goes to say that if I'm going to monopolize your time, I better be serious about getting results, because, I mean, if I was a doctor like you, I wouldn't waste my time with somebody who isn't committed to their own health and well-being. That's just ridiculous. Garrett has a question. Are there certain supplements, vitamins, minerals that can help during the fasting period to help the body balance the sugar and use fat as the source of fuel better? Excellent. That's a great question.
So, in terms of vitamins and supplements, some people use bone broth, which has a lot of electrolytes in it. There are people that use Himalayan salt, which can bring in minerals and give some kind of added electrolytes during a fast. But I usually will implement them or use these things, and also magnesium. But I usually will start using these things when people are on longer fasts. So if somebody is doing 36-hour or 42-hour fasts regularly, then I'll suggest that we bring in some vitamins and minerals in their fasting days. If somebody's just doing 18 hours a day of fasting, then that really is our body's natural tendency if we gave it a chance, so you're probably going to end up getting all those vitamins through your food. The only vitamin that I really supplement with, and that across the board tell people to take, is vitamin D, because a very large percentage of us is vitamin D deficient. We just don't go out in the sun a lot. We're working indoors most of the day, and especially during winter times in some places, you really don't get sun. So I think vitamin D is really important. And if there's any like restrictions in the diet, like vegetarian or vegan, then I talk about B12 and B vitamins. And so it's individual on, it's what I recommend on an individual basis.
Yeah, no, that's an amazing question, because I think the majority of the food that we have access to, even if it's quality food, much of it is depleted in the nutrition and the vitamins and the minerals, because it's raised very differently.
Yeah. Yeah.
Our vegetables, our fruits, our meats, our fish, everything is mass produced and done in such a way just to, get it out there.
Right.
Is if your plate that you have, some protein, some vegetables, some whatever, is very different in nutritional power than your grandmother's, which had the same thing on it. So I think what's crucially important for me personally is that I test myself at least once a year and do a full workup, so I know exactly where I am with a lot of things: my vitamin D level, my absorption of vitamins, my hormone levels, all these kind of things. I want to keep an eye on that stuff because, I mean, you can guess by taking vitamins, but you really need to know what it is that you're depleted in, so you supplement with it. I was taking vitamin D after Dr. Lichtash was working with me. My vitamin D was depleted then. So he kept trying to give me vitamin D, 5,000, 10,000 I used. Nothing, it wasn't budging. So he gave me a shot with 400,000 I used. And it jumped my vitamin D, where it's supposed to be, like in the 90s. So from that point on, I thought to myself, I'll just supplement. So I supplemented. I got sunshine. I love the sun. But lo and behold, a few years later, when I had another issue, I was tested and my vitamin D was again in the gutter. So I think it's important to know your body and to know how it uses things and absorbs things, and especially like vitamin D, man, it's so important.
So important. Yeah. Yeah, I do have patients, some of them that don't absorb vitamin D, and their vitamin D levels remain very low, and then they end up losing bone as a result of hyperparathyroidism, as a result of the low vitamin D. And so it's definitely important to keep up with your electrolyte testing at least once a year, just to make sure that there's nothing brewing under the surface that you obviously won't feel, but can then predispose you to a lot of problems in the future.
Well, great. If you guys, if anybody else has a question, we're happy to answer it. Otherwise, I'll start wrapping things up a little bit. Any other questions? No, I think we did really a great job here, Dr. Lichtash.
Thank you.
Let's, I'll let you, first of all, if you could, out of all the great questions we had, and you guys did so good, thank you for your participation. I'm going to give away a copy of this book, and Dr. Lichtash will choose who we're going to give it away to.
Oh no, put me on the spot. Everybody here is so wonderful.
They are, but only one gets a book.
Only one gets a book. Well, for her enthusiasm and flattery, I think I'll go with Carolyn.
Okay, great. Carolyn, I'm going to give you my email here, and I'm going to need your mailing address. Please get that to me.
You're welcome.
Very, very good. Any final thoughts, Dr. Lichtash?
So you can reach out to me if you have any questions, anything that I could, if you wanted to make an appointment with me, you can reach out to me on my website. It's drlichtash.com. And thank you all for listening, and look forward.
Dr. Lichtash, LICHTASH .com.
drlichtash.com.
Very good. Well, great. So I want to thank you all for being a part of this with us. It was a real pleasure. And I just want to leave you with this thought, that the most beautiful, powerful, magnificent creation on this planet is not a bush. It's not a tree. It's not a mountain. It's not the ocean. It's not a sunset. It's you, the human being. And whatever you need to do, whatever investments you need to make, wherever you need to go to get to the root cause of your chronic illness and enjoy your best life, you're absolutely worth the effort. So I want to thank you so much for joining us. Dr. Lichtash, thank you so much.
Thank you.
Bye-bye.
Bye.